Okay, hello, everyone. This is Dr. Garrett Smith, known as the nutrition detective around these here YouTube parts. Now, we've been doing, got a whole, you guys can't see it much, but I have a whole new desk set up, and we're working on figuring out the live stream software. We're still working on that. Didn't have time to finish it this weekend. Got lots of things going around in my life. And the interesting thing today is that the chat, I can't seem to get the chat to scroll back up to the top. I don't know what is going on with this chat. Anyway, so what we are going to do, can you guys scroll back up the chat to see like the very first chat? Because I can't. So if you can tell me in the chat, that'd be great. Anyway, if there are any super chats, hopefully I can find them. First thing I'm going to go over today is a super chat that I missed. So I want to apologize, first of all, to The Greatest Story Ever Lived is their YouTube name. I missed a $5 super chat, and I want to cover that. So, because this is something I'm working on helping even my own daughter on. For those of you who think that, your children just automatically do exactly what you say when they're like 14-year-old girls, you've obviously never had kids. So anyway, having children teaches you all sorts of interesting things about, I always know when somebody says, well, if I would parent, it would be this way. And I go, yeah, you obviously don't have kids. Because things don't always go the way you expect. And especially when you have two households, where the children are living in, things don't always go the way you want. So here's the question. Teen daughter has tried to eat super healthy, but is feeling desperate/hopeless about severe acne. First steps with a question mark. And she says she never took a prescription for it. Well, those of you who have had acne in the past, you know that this is a big problem, and prescriptions. Okay. Prescriptions for acne, kind of like birth control pills, will potentially reduce acne for a while. If these are used, the whole way that they reduce acne is by reducing the amount of bile leaking into the blood. So you have to think of acne as like an expression of toxicity out of the skin. That's really what it is. That's why you're making whiteheads that you can squeeze the gunk out of, right? This is like, that's the toxicity. So key things that I've found. Now it's funny because the mainstream says diet has nothing to do with acne. Like when I heard that gastroenterologists were saying that your diet has nothing to do with your colitis or your Crohn's or whatever. And I was like, doctors are supposed to be smart, and they're actually telling people that what you eat that touches your gut lining all day has nothing to do with your gut problem. That would be like a dermatologist saying what you put on your skin has nothing to do with your rash that you developed. When the person goes, but when I stopped this lotion, my rash went away. And then the dermatologist is going to be like, how stupid a dermatologist would it be to say, well, that had nothing to do with it, right? And the person with the gut problem says, well, if I don't eat this, my problems can go away, or my problems are 90% less. And the gastros will honestly tell them what you eat what you observed in your own body has nothing to do with your problem. Now, next thing to think about, this is something that's taught in a lot of alternative medicine, which is, it's a decent concept, except they still haven't figured out the bile connection to it, is that what is going on in your skin is theorized to be reflective of what is going on in your gut. Okay, so if you're having skin issues, here's the funny thing about alternative medicine, and this is what I was taught in naturopathic medical school too. They say that if you don't know where to start with a person's health issues, start in the gut. It all begins in the gut. And I'm like, okay, this Sort of true, because what's the thing that's irritating your gut? Well, it's your toxic bile. When they say address your gut, what they're really saying is they don't know it yet, but they're saying it's toxic bile. Because then the toxic bile can leak into your system and cause everything. So if their slightly misdirected concept is saying in a way deal with the toxic bile because that's what's causing the gut problem, they are kind of saying something right. It's just nobody talks about the bile. The only thing like even naturopathic doctors talk about is they talk about increasing your bile production or thinning the bile or whatever. And they have no idea that when they talk about toxicity in the blood, they're talking about bile too. Okay. So back to the question about acne. Diet absolutely has tons to do with acne. I mean, the biggest things, it's funny, the things that I've seen in people who I've worked with, that if they get their children to do these things, it helps the acne. So sugar, especially mostly added sugars. We've talked here about how sugar causes cholestasis, liver damage, toxic bile leaking into the blood. Sugar is huge with acne. My daughter even knows this because I'll point it out to her that like when she decides to eat really clean, she has less acne. Now, eating super healthy as a term, like nobody can come to me and say, I eat super healthy. Why am I still sick? And I'm like, your super healthy is probably not my super healthy. You know, there's no kale salads in this diet. There's no like eating tomatoes for healthy. There's no like my super healthy diet is not everybody else's super healthy diet. And this is why we get different results. So, but I mean, the very biggest things that I see with teens that they can change would be sugar intake, like no added sugars. You want to have some fruit? I'm not that worried about that. People are like, you say fructose is bad. And I'm like, if you're having a couple of pieces of fruit a day, I'm not worried about that. Excessive fructose is bad. What do we consider excessive fructose? Added sugars. How's that? Okay. I just went over a couple of live streams ago about there's that tribe in Africa where they do their fattening ceremony and they drink a bunch of dairy. They eat raw dairy and they drink blood and they eat lots of honey and they get these giant bellies just like Americans have. So could you get excessive fructose from honey? Yes. Generally, remember, the sweeter something is, the more fructose it has in it. That's why people like that agave nectar or agave syrup or whatever it is. Because it's as high in fructose as high fructose corn syrup is. Come on. That's why it's so sweet. So anyway, sugar and acne go absolutely hand in hand. Dairy and acne. What do we try to avoid out of dairy? We try to avoid the high calcium. We try to avoid the excess vitamin D that's in there and the vitamin A. Don't eat vitamin D if you can avoid it. Avoid vitamin A and don't take in excess calcium. There's 4 times as much calcium in cow milk as there is in human milk. Do you think that was put in for the cows for a reason? Do you think that, I mean, the idea that like, it's so weird that humans are like, well, cow milk is okay, but everything else is weird and gross. Like, are you speciesist? Why are you discriminating against other animals' milk, right? Why in the world would you not want human milk? I mean, be speciesist to your own species, at least, right? Why would you be anti-human milk if you really want dairy? I'm not saying I advocate this. I'm just saying it doesn't make any sense. So, absolutely dairy and sugar. And why chocolate? Because chocolate's full of copper and chocolate's full of polyphenols. Polyphenols slow down your detox. Hey, we're talking about detox here. Excess copper is a disaster. So you'd want to avoid the very highest foods in copper, chocolate being one of them. And what do we always add to chocolate? Sugar, right? There's still plenty of sugar in dark chocolate. And the thing to realize, folks, is if you really want to know, I mean, chocolate and coffee without sugar are bitter. They're quite bitter. They are marked as toxins by. So don't eat them. Don't eat them added with sugar or dairy. Gosh, what are they? I mean, really, chocolate and coffee, bitter, marked by nature, dark, strong colors. And then we go and we add sugar to them and we add dairy to them. Birds of a feather flock together, right? Poisons. We love to put poisons on top of poisons. So those would be where I'd start. Then now you have to know that these things don't just automatically get better, because by taking poisons out of the diet, the body gets a relief from the poisons coming in, the intoxing, and then it will start detoxing more. So this is not just immediate. And then a huge thing in the research is zinc helping acne. What does zinc do in the body regarding vitamin A and copper? It helps to get rid of copper. It helps to protect us against copper. Get rid of vitamin A. It helps protect us against vitamin A. So zinc is a huge thing for acne. Now, severe acne, I'm going to tell you that severe acne means pretty, stronger toxicity than just regular acne. That makes sense, right? The dose dependence, like, related to the toxicity of the skin condition. So this is not going to be an overnight thing. I mean, somebody could go and take Accutane or cod liver oil and start shutting down their detox and see immediate improvements in their skin. You are damaging your liver for the future. Now, the acne may not come back in the same way later, but your liver damage and the toxic bile leaking will show up somehow in the future as a different health problem. People always want it to be the same health problem. No, you can change one health problem into another. You can transmute your health problems from one thing to another. And how do we do this? Through the amount of bile that's in the blood, through the toxicities in the bile, through the recipe of the bile, the specific bile acids. Now, I saw somebody asking, how does this whole toxic bile thing work? Look at my live stream 71 on this channel. I don't have time to explain the whole thing today. But anyway, so those are the things that I would work on for the simplest things for severe acne first. It would be no chocolate, no added sugars, no dairy, figure out some zinc. Now, for a full-grown adult, without any testing, no testing on zinc. You're not doing any testing. You're just winging it. You're guessing, which is what you're doing. I would not have an adult take more than 30 milligrams of zinc picolinate in a day without testing. With testing, I use more than that often. But I'm not your doctor. If you're just here listening to me, I'm not your doctor. And I'm going to give you my hedged recommendation for what I generally see working. Now, in my Keystone Minerals, my mineral supplement on our website, nutritiondetective.com, in the shop, that's what's in there, 30 milligrams. So, zinc, no added sugars, no chocolate, no dairy. And then minimizing vitamin A in the diet would be the next big step. And that's all in the Love Your Liver program. So that's that. Thank you for that super chat. The greatest story ever lived. That was great. Now I want to go over the testimonial. So I had someone message me questions and a testimonial. So I want to go over this. I'm going to, yeah. And so here's, okay. So I just saw a chat come up. I want to address this real quick. Bob Dill in the chat said, I am very sensitive to zinc, a little too much, and I have a terribly runny nose. Do you see why I say, wait, so what would we do about this? Does this mean that zinc is bad for this person? It means that it's too much for them right now. This is really, really important concept. So if I say I wouldn't have an adult take 30 milligrams or more without testing, Well, somebody on the Love Your Liver network the other day got our liquid zinc, which is in our shop too, and they took 1 drop, which is 2 milligrams. 1 drop of our liquid zinc is 2 milligrams of zinc. And they noted lots of benefits from it right away. And then they said 7 hours later, they got really tired. What happened? Well, when you learn about these things from me, you start to understand what happened at first was so many of us, especially you ladies, your energy levels are dictated by your copper. Here's the weird thing. When you're kind of high on copper, and I mean almost like by getting a high off of copper, copper is extremely stimulating. It pumps your cortisol and your adrenaline. You can become addicted to that, right? Why do people take speedy drugs? Adrenaline and cortisol, right? It gives them a high. So copper can do the same thing. So if your body is used to running on copper and that gives you whatever energy you have. So you take some zinc at the start, and here's the weird thing. You feel better. This is not everybody. Some people take zinc and just makes them tired. And then later, as they get the copper out of their body, then their energy level increases. So this is the biggest mistake that people make in medicine. I'm going to help all of you out here who are trying to help your friends and family. The biggest mistake in all of medicine is assuming that everybody has the same reaction to the same thing. That is horse crap. People can have diametrically exactly opposite reactions to the same thing at the same dose. And if you can't handle that thought, you should never go treat anybody. This is like the people who go to practitioners and the practitioner says, oh, you have this problem, take this supplement. And the person comes back and they go, this supplement makes me feel horrible. And the practitioner goes, that can't be. That can't be. And the person's like, okay. And the practitioner says, go home and take it. You'll adjust to it. You'll get past this little detox or whatever. And the person comes back and they're like, I couldn't take it. I can't take this. And then the practitioner, you know what I've heard many people come back to me and say? The practitioner fires them. The practitioner says, if you can't take this supplement, I can't help you. You need to go work with somebody else. How pathetic is that, really? If you're a practitioner and you've done this at that phase of your learning, that was a pathetic thing to do. To blame the client and shame them for not being able to take the magical supplement that obviously fixes their problem. Okay? It wasn't working. So let me tell you, let's go back to that zinc thing. So they get, let's say they take this zinc and it brings down their copper for a while. So they feel better for a while, 7 hours. You ever notice like people who are addicted to coffee can usually maybe not drink their coffee first thing in the morning and they're all right until they hit midday or the afternoon. And then all the stuff hits the fan. I have a headache. Oh, I have to take a nap. So they may have even felt better without their coffee in the morning. When they first woke up and they have their natural adrenaline and cortisol, you ever see those coffee people where they say the best way to do your coffee is to not drink it first thing when you wake up? Because that's your natural adrenaline and cortisol pump. And then don't drink it if you don't need it until later in the day. See what I'm saying? So they took the zinc, they felt better because it was giving them the defenses against the copper and the vitamin A toxicity. And then when their normal high, adrenaline and cortisol high from that stimulant copper, not a good stimulant, bad stimulant, but their natural high faded and disappeared. And now they're super tired. Okay, so we had a person feel better and worse from the same thing. This is how health works. This is why so many people don't get it and can't deal with people like I do. So what is my advice to this person about zinc? This is 2 milligrams, folks. Am I okay with their reaction? Yeah, I'm absolutely okay with their reaction. Their reaction is their reaction. I assume that people who come to me for help or who are posting on the network are posting the truth. Because if they're lying, it doesn't hurt me. It only bothers them. So what did I talk to this person about? Well, they might only want to take 1 milligram so they can get some of the benefits without so much of the negative, because it's all dose dependent. The more you take of something, the bigger your response. The less you take of something, the smaller your response. So we could lower, they could lower their dose. And it is quite possible with zinc that the benefit would start staying and they'd get less sensitive, and then the reaction to it would go away. Just like if you quit coffee after so long, you stop having the withdrawal symptoms. Does that make sense? Okay, so with certain things, it would be like, I could tell this person, well, you obviously just need more zinc. Just take more and more zinc. And they're like, now I can't even function during the day. I'm so tired all the time. Well, that might go away for a while, but why do that? Just like I would tell somebody who wanted to quit caffeine, well, if you've been doing 2 cups of coffee for a really long time, why don't you go down to 1.5 for a week? Not make your life suck. Go down to 1.5 for a week, and then go down to 1 for a week, and then go down to half a cup for a week, and then even go down to a cup of green tea for a week, and then quit. Yeah, it takes longer, but are you getting narcoleptic during your workday and getting yourself fired? No. Hey, amazing. We can solve both problems at the same time. Okay. So this is the thing with zinc. It can absolutely make people not feel great, and this usually means, and this is not a passing judgment. It usually means that people are quite copper toxic, and that little bit of zinc that they take kicks a lot of copper out of their liver. Your situation where you're talking about the runny nose and stuff like that, it kicks a lot of copper out of the liver. Floating through your system causes symptoms. So you're not, what would I say to people about that? If let's say I had a test on them and it said, you're low in zinc on both hair testing and blood testing. You're low on zinc. We're going to try some zinc. And we see how you feel. If you don't feel good, I'm not going to make you suffer to take it yet. What we do is you don't take it yet. You work on the detox for now. And maybe you try to get zinc from foods like red meat. And eventually, as you detox more and you get cleaner, people find that they're able to take more zinc, or they're able to take it at all, or they're able to take more. So the way we work is we test. So we're not guessing, and we can find that there's a deficiency. Okay, there's a deficiency, so we try to address it. If we can't address it right at the beginning, okay, we wait. It will likely correct itself over time. I mean the reaction to the zinc, let's say, and then we can add it. Okay? So this is how we do things. So if you know, and if you had well, I'm not going to go into dosing for kids and all that stuff. It's too confusing for the regular world out there. So again, remember, I'm not giving medical advice on this broadcast. If you are a client of mine, I do all that inside the Love Your Liver network in the office hours with people who are working with me on testing. Otherwise, if you're not working with me as your doctor, I'm not your doctor. Okay? So, let me get into this testimonial. So, for those of you who are who have been in the program for a while, many people comment. So, I want to be very clear here. We do not treat parasites. Now, what does that mean? Well, first of all, if you want to go and look at the liver injury connected with antiparasitic medications or antiparasitic herbs or other things that people give for parasites to treat parasites, they are extremely damaging to the liver. Okay? They absolutely negatively affect the liver. Go look up wormwood in the liver. It's disaster. Black walnut. They can really damage your liver. So that's a weird coincidence that all these anti-parasitic things harm the liver? Well, this is a general good thing to follow, people, is if nature makes something, well, nature or humans making synthetic stuff, if we make something that harms or kills another living thing, insects, pesticides for killing weeds, parasite things, if you are making something or taking something that damages living things, it's probably bad for you too. It's just a general thing, right? You can argue that all you want, but you'd be safer. The precautionary principle, if you don't know what that is, go look it up. Or if somebody wants to post what it means in the chat, go ahead. The precautionary principle means to basically, if you have reason to be suspicious of something, then maybe you shouldn't do it until you're really sure that it's okay. That's a very shortened version of it. Okay. But if you can take an herb that supposedly kills parasites, it's probably not good for you because it's killing a living thing. Okay. So we don't treat parasites here. But I want to show you that, gosh, we do seem to get rid of them. How do we do that? Well, let me just go over this testimonial. Now, for those of you who are doing the Love Your Liver program, and you have seen what you suspect were parasites in your poop, feel free to comment in the chat or in the comments later. Make sure to, obviously make sure to like and subscribe to the channel. If you're in the chat right now, please X out and go like this so other people see this. But think about it. Parasites this is something, a concept that people don't understand. Parasites like dead or diseased or dying or necrotic tissue. They like bad tissue. That's what they feed on. That's what they thrive on. Why? Because that tissue doesn't have great immune system. It doesn't have great defenses. Parasites are like bullies to your intestine. They want to pick on the weak stuff. They don't pick on the strong stuff. And I went over before, I had an old veterinarian, a holistic veterinarian book, and he said it always seems like the sicker looking dogs are getting the parasites. And the really healthy looking dogs that stay healthy all the time don't get the parasites. We don't have to treat them for parasites. So chicken or the egg, is it the healthy dog preventing the parasites from ever getting a foothold, or is it is it the unhealthy dogs have sick tissue, right? As we went over earlier. When in doubt, treat the gut. Well, where do parasites tend to live? In the gut. Okay, you got a sick dog? It's probably got a sick gut. They seem to get parasites. What a coinky-dink. Okay? So what would happen if, and let's say theoretically, in this little toxic bile theory world of ours, that it's the toxic bile that is damaging and destroying and causing disease in your gut tissue, which then we're all going to be exposed to parasites. But why do the parasites not inhabit everyone? We all have candida in us. Why doesn't everybody have candida? Do you see these questions, right? We all have Staph aureus on our skin. Why isn't everybody getting Staph aureus infections every time they get a cut? Okay, your immune system, which is your toxicity cleanup system, more so than your pathogen defense system. If you think of your immune system as your toxicity cleanup system, everything starts to make more sense. Okay, so what happens in our program with parasites? And I've seen this with many other people. I had an episode of this very early on in my vitamin A detox. So let's go over this. So this is a woman. She said, found a tapeworm in the toilet a couple days ago. And today there are small red worms. And she put the emojis of like the sick looking emoji and the crying emoji. She said, I am so upset, but also not sure if maybe this is good and means I'm detoxing. I don't know what to think. Just so upset about it. I have a picture from today. Now, I didn't ask her for the picture. I'm not a parasite identifying expert. But let me tell you what I said to her. I said, this means your intestines are getting so healthy that your own body is dispelling parasites. I said, it's okay to be upset. It's like someone broke into your house. It's a feeling of violation. Continuing, but truly realize that you didn't need to do anything anti-parasite to get these things to come out of you. Parasites feed on dead/diseased tissue. We are reducing that so they run out of food, die, then come out in your poop. And I put in all caps, this is wonderful. You're not the first to have this happen. Don't worry. Keep doing what you are doing. And then I asked her if I could use a screenshot of these messages. I said anonymous, of course. And this is the final reply from the woman. She put 3 crying emojis and she said, thank you so much. That's exactly what I needed to hear. Follow along here. I just recently cut out all alcohol and started just eating tons of meat and fruits and vegetables and organic sourdough bread. Now, I'm guessing this woman is eating low vitamin A fruits and low vitamin A vegetables. Okay. And organic sourdough bread. I really don't want to take an anti-parasitic, but last time I had a tapeworm, I did. So I was just worried and upset. And she put in all caps, thank you again. And then she said, sure, I could use the screenshot I could use the screenshot. So I will be putting the screenshot of this testimonial up on my Twitter and my other social media stuff. But I hadn't gotten around to it yet. Now, my personal experience, and other people have noted this on the Love Your Liver network, is there was a time earlier on in my detox where when I would poop, there was little white, I would say like a BB, like the BB guns, like BB sized little white things in my stool, in my poop. And many, many other people on the network have seen this. Now, somebody out there might say, well, it's obviously something you're eating. This was a temporary thing. It started, it went on for however long, days, weeks, and then it stopped. If you were pooping out something biological in your poop that was dying off, right? It's a die-off pattern. And I don't get too much into Herxheimer. I think Herxheimer reactions are a bunch of made up stuff. I haven't seen enough evidence of it actually being what they call a Herxheimer reaction to be. It's a detox reaction, folks. It's not, all the pathogens are dying all at once and spilling toxins into your system. No, it's toxins. It's toxic bile. That's what it is. So anyway, if you have had this response where like all of a sudden in your poop, you start seeing things in your poop that you haven't seen before, and then they fade away or they just stop at one point, like it goes on for days or couple weeks, and then it disappears, and you were kind of eating the same things all along that time, so it's probably not what you're eating, because if it was what you were eating, it would have been going on before that, and it would have continued after that, right? But if you've had that happen, like many people in the Love Your Liver network have, feel free to comment and give us more anecdotal evidence, right? Because that's what everybody's going to call it. And no, I don't know how to get these identified as parasites. The lab that I used to use called parasitetesting.com, they don't do it anymore. They used to say you could send them samples and they would analyze it and tell you if it was a parasite or not. Like you send them a dead body of what you think is a parasite. They don't do it anymore. So I don't know how to get those analyzed anymore. Sorry. Anyway. So let me find, I did see a super chat. Okay. Victoria's asking, saying, watched episode 80. Update us on your magnesium lotion. Since you paid, I'm going to address this. I'm going to suggest to you folks, do not harass Julie, my practice manager, about when it's going to come out. For me to get this right, so you want to know, I'm not even going to say we're close right now because I thought we were close and then we had to reformulate. I think we're on our 14th or 15th formulation right now because of different things that have come up. Like when we shipped it, in the cold, and then it got here and it was hot, it had separated. Like because we were trying to keep things as natural as possible. And for those of you who have tried to make your own magnesium lotions, you know that they separate. They absolutely can separate, especially once they're involved. So, and people want it to be as absolutely few ingredients as possible, and that's great. Until all of a sudden you're putting things through. It's not just staying in your house in your temperature controlled area all the time. So we have had to do, I formulate things in the way that I demand to formulate them. And there's also, like I was joking the other day about why people are so upset about additives and fillers in their capsules, right? We want capsules with no additives and no fillers and no anything other than what you would put in them. And then if they got a 30 milligram capsule of zinc with just zinc in there, it would be just a little bit of powder and the rest of the capsule would be empty, and they'd be so upset and they'd say, why aren't you giving me all the stuff that I ordered? And they'd be like, no, that's really 30 milligrams of zinc in the capsule. And they'd be like, it should fill up the capsule. And you're just like, oh my goodness. Really? Really? You want a full capsule, but no additives and fillers. There is no capsule size that fits 30 milligrams of zinc. It just doesn't exist. So making really clean supplements is harder than people think. And if for those who are okay with the taste of powders, you can always go get powders. A lot of people take powders for a while because they think they're tough enough, and then after a while they get sick of the taste and they stop taking them because they don't taste good. Those are supposed to be distributed within food, so you don't taste it. Anyway, so about the magnesium lotion. I just received the newest sample the other day. We are in our testing of it now. Now I know that Life Flow's magnesium lotion is out of stock, so we really want to get ours out. We just got to finalize this formula. If this formula is good, like this formulation has been like a year and a half now. It really has been a long time because I'm very discriminating in what I will allow or not. So we are close, but we were close a month ago, and I decided that one of the ingredients I wasn't okay with, so we had to toss that out and put in something else or replace it with, I think we took out 2 things and we're putting back in 1 or something like that. So, but a lot of folks don't realize just how much things can grow in these formulas. You start getting like, it was crazy. Julie, my practice manager, she's been purposely like getting her hands dirty with gardening and stuff like that and putting it in the lotion and then letting it sit out to see if things are going to grow in it, because things growing in the lotion is not cool. I'm not trying to give people mold. So we are getting there. I mean, honestly, when you start formulating these lotions, you go, how is anything growing in there? Like, it's just fats. Like mold doesn't normally grow on fats, but you get enough of other ingredients in there and things can start growing. So we have to, the formulating these things, trying to keep it as natural as possible and as client pleasing as possible. Boy, this is a lot of balls to juggle at once. So anyway, we're working on it. Okay, so let's see. But we're close, but I don't want to put a date on it. I will say that our sun fiber, our organic, there's another organic sun fiber company on the market. You can find them on Amazon. We are coming out with an organic sun fiber that, well, the other company hasn't put theirs out again. They seem to be out of stock for a very long time. So our organic sun fiber will be coming out soon. I believe they are putting it together into the bags. But again, for those of you out there who are considerate, don't bug Julie about products coming out. That doesn't help them come out any faster. And we will announce them as soon as they're ready. We if we're going to do pre-orders or any of that stuff, we will announce it. Okay? So, let's see. Oh, prostate cancer. Prostate cancer and vitamin A, the big topic of the day. First, I'm going to post my post from my old website, nutritionrestored.com. Now, first, let me go over why this is an especially important topic to me. Now, my father died of, well, he had prostate cancer. I'm pretty sure it was the chemo that killed him. I think he went through 5 rounds. And this was many years ago before I knew all that I know now. And so yeah, he had I think he was diagnosed with prostate cancer 12 years before he died from it. And it's a big dramatic family story, but I'm not going to get into that. And I started to develop urinary issues when I was in naturopathic medical school. So I was like 25. So I was following in my father's footsteps at a very early age. And this is what I'm trying to tell you guys is like the weakness. So we get the strengths from our family tree, but we also inherit the toxic weaknesses. We all have weak links in our chain. And your weakest link is the one that will tend to break first. So in my genetic line, between the vitamin A toxicity and my genetic weak link, that was probably where one of mine was going to show up. Funny thing that I'm into vitamin A now, and what do I think also contributed to my dad's toxicity? Well, my dad was a dentist. He was an amazing dentist. He quit doing mercury fillings like very long ago. He said, not doing this. And funny story about the EPA and other things, but it was yeah. So my dad's always been, he was an amazing technician as a dentist. People died before they left his practice. He didn't take new patients for like the last 5 years of his practice, unless I recommended them or something, or he knew them. So the toxicity in dentistry, it's a lot. So he had the years where he was doing mercury fillings before he decided to stop doing them. And then there's just the exposures of being a dentist. Dentistry is horribly toxic. So prostate cancer is of interest to me. So I'm going to go, let me post this. All these paper links are in the Nutrition Restored link that I'm going to put, but I'm going to put all the separate studies too. Here's the title of the paper: Serum Retinol and Carotenoid Concentrations and Prostate Cancer Risk. Results from the Prostate Cancer Prevention Trial. I'm going to say that I don't think their results came out the way that they wanted. Here we go, quoting. In this prospective analysis of serum retinol, that's how much vitamin A is in your blood, which is not necessarily indicative of how much is in your liver. Okay? In this prospective analysis of serum retinol, carotenoids, and prostate cancer risks, we found positive associations between serum retinol and total and high-grade prostate cancer, and between serum beta-carotene and total prostate cancer in the placebo arm of the PCPT, the Prostate Cancer Prevention Trial. Positive association means they found as blood vitamin A went up, total prostate cancer went up, and as total vitamin A in the blood went up, high-grade prostate cancer went up. That's what a positive association means. It means they're going up together. Continuing. In addition, a recent pooled analysis, which included data from the PCPT, reported a 13% increase in prostate cancer risk in the highest quintile of serum retinol relative to the lowest. So they divided the 20%. They had 5 groups of vitamin A levels. The highest 20% versus the lowest percent. Highest percent had 13% more prostate cancer risk. Now I'm going to tell you, you don't get higher this is hard to explain. People can have really high vitamin A in their liver and still have a normal to low blood vitamin A, serum retinol. But I'm going to tell you that for your blood vitamin A to get higher, it's generally also going to mean that your vitamin A in your liver gets higher. So the weirdest thing about this, and this is in the research, I've been over this before. You can have low vitamin A in your blood and still be super toxic in your liver. But I can tell you that if you have high vitamin A in your blood, you guaranteed have a ton in your liver. Okay? But you can hide it even if you have low vitamin A in your blood. Okay? It's in the research. Here we go. Conclusion in the placebo arm of this prospective study. So the placebo arm where they did nothing. High serum retinol and beta-carotene concentrations were associated with increased risk of total and high-grade prostate cancers. Okay. Let's look at some other papers. Serum retinol and risk of prostate cancer. Men with higher retinol concentrations at baseline were more likely to develop prostate cancer. The results were similar for aggressive disease. In this largest study to date of vitamin A status and subsequent risk of prostate cancer, higher serum retinol was associated with elevated risk, with sustained high exposure conferring the greatest risk. So the longer they had higher vitamin A, the more their risk went up. Okay, now let's do this. Let's do abnormal levels of retinoic acid in prostate cancer tissues. The only other notable association we observed in this match set analysis was a higher geometric mean plasma retinol for all prostate cancer cases compared to controls. Well, now, talking about vitamin A toxicity connected to prostate stuff, I was developing, I'll just tell you about my history. I used to have to, my prostate, whatever, at bedtime, I had to go pee 5 times before I could go to sleep at night when I was 25. If I felt like I had any urine in my bladder, I could not sleep. But sometimes it was so little urine that I couldn't feel it, and it would still not let me sleep. So I had to go a bunch of times to make sure that it was all out so I could sleep. I don't have that problem anymore. That was when I was 25. I'm 47 now. If anybody knows anything about men and prostate problems, they only get worse as you get older. In general, that's the normal stuff. We're not normal. We don't settle for normal. So now I have no urinary. I used to wake up 3 times a night to pee. Now I generally don't wake up in the middle of the night. If I do, it's once. And I'm going to tell you honestly, to wake up once, think about it. Do you go 8 hours during the daytime without peeing? Probably not. So if you think that all of a sudden you have to go 8 hours at night while you're sleeping without peeing, doesn't that seem kind of weird? So I'm okay with waking up once in the middle of the night to pee. I'm okay with that. It's 8 or 7 or 8 or 9 hours. Why could you not wake? If you can't hold it 8 hours during the day, why should you hold it at night? See what I mean? So I'm okay with not, it's great if you don't have to wake up at night to pee. If you wake up once, that's okay. If you're waking up more than once, we can look at a bunch of things. It could be that you're just drinking too much water. It could be that you're deficient in magnesium. If you're deficient in magnesium, you will tend to have more urinary frequency and more urinary urgency. You could be dumping a lot of toxic bile into your blood, which then, if you know the detox order that we've talked about, it then goes to your kidneys. The kidneys are the number 2 stop after the liver. No, that sounds funny. Number 2 stop. Anyway, because kidneys are urine. Get it, right? That's number 1. Anyway, so kidneys is what it hits next. Now, if you think about it, if your kidneys are filtering out a bunch of poison and putting it into your urine, and that urine goes to sit in your bladder, do you think your bladder wants to just sit there with marinating with toxic piss in it? Or do you think your bladder would be like, look, I want to get rid of this. Like, get up, go pee. I don't care if you have to pee 5 times during the day or 5 times extra during the day. I don't want this toxic piss sitting in me, right? So that's one of the things about urine is if it's toxic, your body would rather pee it out than keep it in. It's a detox route, right? So why would your bladder want to suffer? So if you tend to have bladder infections and other bladderitises, you probably have toxic urine. And if a lot of toxic bile is going in your blood to your kidneys, it means your liver is obviously overloaded because your body wants to get rid of that toxic bile through the liver route. So yes, Joe was pointing out, he said, I wonder if the urgency to pee might be trace amounts of bile in the urine, bile and all the other toxins. So for those of you who are new here, when we talk about toxic bile, you detox tons of things into your bile. Vitamin A, copper, manganese, lead, cadmium, arsenic. You put toxic things in your bile. So when we talk about toxic bile, it's not just about the bile acids, which can be plenty toxic in themselves. We're talking about toxic metals. We're talking about toxic chemical compounds. We're talking about the fats, so the forever chemicals and these other things that your body may be able to get rid of in the bile. We're talking about all the toxins. If you think, your liver detoxes everything, your liver doesn't, in a way, you don't detox until it's out of you. Okay. So your liver doesn't actually get rid of anything. It puts it in the bile, which then you could poop out. Or if you're leaking it, it goes into your blood and it can come out your kidneys. Or if you're sweating it out, which is your third route, it could come out on your skin. And it often causes skin problems because it's so toxic and you just pushed it out of your skin. Like, just imagine putting a toxic lotion on your skin and it causes you a rash. Well, then just imagine toxic stuff coming out of your skin and sitting on your skin. The other way that we can realize that acne is toxicity is people will say, if you just wash your skin enough, the acne will be better. What are you washing off? The toxicity that's coming out of your skin so it's not irritating you. Does that make sense? Now, you could cause plenty of problems by washing your face too much. Yeah. So let me see. Let me just double check. So that was, I got the update on the magnesium lotion done, I think. Let me see. No more super chats. I didn't miss any super chats. Pierre's always the one who points out, he tells me later, he's like, you missed a super chat. And I'm like, damn it, again? Yeah, I can't go back to the, I get it. Okay, I can't go back. No, to the chart. I can't go back to the chats that happened before I started, I guess. Anyway. Okay. So, okay. I know CK said, what's with them saying that riboflavin is like a treatment for alcoholism? And then he also says, see also Dr. Axe saying riboflavin helps to prevent cancer, including prostate. I need to put up the article in the Love Your Liver program about B vitamins as antidotes. High-dose B vitamins are antidotes for some sort of toxicity that's already in you. That's what they do. You ever notice that the RDA of B vitamins is super duper low? And yet you have people who feel like they have to take these mega doses of B vitamins to prevent their issues. And I'm not denying that it helps their symptoms. What I'm saying is, if you have to constantly, think about it, your bloodline, if your genetic bloodline needed mega doses of B vitamin supplements to survive because of epigenetics or whatever, your bloodline would have ended years ago. Before there was B vitamin supplements, there was never like thousands of percents of RDAs of B vitamins in foods. There never was. There used to be more, sure, but nothing like the pill doses that people are taking today. One of the things I work on is getting people to stop eating so much dang sulfur. Well, you know what excess sulfur will make in your body? Hydrogen sulfide. Do you know what B12 has been found to be a remedy for? Hydrogen sulfide. So if you're out there finding that you have to take mega doses of hydrogen sulfide or B12 to relieve your symptoms, what I'm telling you is you're poisoning yourself somehow with hydrogen sulfide. It's a toxic gas. Your body can convert the sulfurs you eat into this. Okay? Folate, you need folate to run ALDH, aldehyde dehydrogenase, the most, in my opinion, the most important detox enzyme in your system. I have shown that vitamin A, which turns into an aldehyde and an alcohol, vitamin A depletes folate and B12. So if you're out there eating a bunch of vitamin A because you think eating the rainbow is going to help your health, and eating liver, and egg yolks and dairy and pork are going to help your health, and then you're finding I have to take these mega doses of B vitamins to get my symptoms to relieve, you're taking an antidote for the poisoning that you're doing to yourself. You probably also have a molybdenum deficiency because you need molybdenum to process sulfur. And what we find is as we detox people properly, they end up needing less and less B12 or folate or whatever I never have people take B3 or B6. Those I just don't. Do you know that, here's one of the biggest lies they told you about B vitamins. You know how they say B vitamins just, if you don't need them, they just pass through you? You just pee them out? No. B6, pyridoxine is an alcohol. Pyridoxal 5-phosphate is an aldehyde. It's pyridoxaldehyde. You store it in your nerve endings. B6 toxicity will cause neuropathy. Why didn't they tell you that you store B6? Maybe they lie to you a bunch about B vitamins. So, but B12 is an antidote for hydrogen sulfide. You can look it up. It's also an antidote for cyanide toxicity. B1, which is really popular nowadays because somebody's selling a disulfide version of it, allithiamine, that was originally derived from garlic. B1 binds to aldehydes. Gosh, does anybody ever talk about aldehydes? B1 binds to aldehydes and helps make them less toxic while your body gets rid of them. People are mega dosing B1 now. And some of them are having amazing results. Did they have a massive deficiency of B1 or were they just aldehyde toxic? The guy out there selling the most B1 right now totally denies that vitamin A toxicity even exists. If people started eating less vitamin A, they might not have as many aldehyde problems and then they might not buy as much B1. That's a weird concept. It's like the organ meat sellers denying vitamin A toxicity as they all get sicker and sicker. So, let me see. Let me just double check. Okay, so I'm going to start up at the top with the questions that are here. Sorry if you posted questions before. Oh, Sam B, are you still here? If you're still, if Sam B, if you are still here, Sam posted a testimonial. He is an Accutane survivor. if you have that testimonial, Sam, if you're still around, if you can post in the chat, I'll read that off, because that was a really great testimonial. But riboflavin, for those of you who are in the Love Your Liver program, Ludovic P, that's his name in the network, he posted some great articles, research links about how toxic riboflavin was. Riboflavin is very yellow. Riboflavin is what turns your pee that fluorescent yellowish greenish color when you take it. Now, I just have a real quick question, folks. If B vitamins are so great, why, when you take a big dose of them, does your body work so hard to piss them out so fast? Interesting question, right? So, okay. Let's see. Let me find a question. And Ramon, if you're still here, if you, I think you posted some good stuff right at the very top. So, let's see. Beth was saying, question, you speak a lot about copper, aluminum, and zinc. What about mercury and the as of yet difficulty over the years to reduce it in hair analyses? I have no problem reducing mercury. I have absolutely no problem reducing mercury on hair analyses. I get people down to the 0.01 is the lowest digit that they have. It's quite simple. This is what people don't do. You get all the mercury out of your mouth. First step. If you have mercury fillings, they are poisoning you every day you have them. Do not believe the dentist propaganda that after 10 years or 20 years or whatever, they stop off-gassing. That is the biggest load of garbage that they could have ever told you. If you go to the IAOMT YouTube page, you can find a video where they have a 40-year-old mercury filling from somebody's mouth that they have taken out. And they rub it in front of a black light with an eraser, a pencil eraser. And then you start seeing in the black light gases coming off of this thing. Mercury gas. Every time if you have mercury fillings in your mouth, every time you drink something warm or you chew something, you are off-gassing mercury into your mouth. You are breathing it down. You are absorbing it through your oral tissues. So, the first step of detoxing is to stop intoxing. This mercury fillings don't even show up on hair testing, if you did not know. Mercury fillings are inorganic mercury. They're like the metallic mercury. They don't show up on hair tests. What shows up on hair tests is mercury from fish and shellfish. That's the main source. It's the organic mercury, the methyl mercury. Or is it methyl? Yeah, I think it's methyl mercury. Sometimes I get them confused. Anyway, the thing to know is that they don't show up on the hair test. The fillings. Fish and shellfish does. So I very simply tell people, first we got to get the mercury fillings out of your mouth, because you don't have to run the urine tests to find out if there's mercury in people's system. If they've got mercury in their mouth, if you've got mercury in your mouth, people, you're mercury toxic. Very simple. Don't let anybody tell you any different. I even tell people, one of the very first articles in the Love Your Liver program is, if you want to work with me, and let's say somebody's having to choose between working with me or getting the mercury fillings out of their mouth, because we all have to make financial decisions, right? We all have to make choices. I can do this right now. I don't have enough money to do both, but I got to choose one. I tell people, get the mercury out of your mouth first before you spend money with me. Because if you don't get the mercury out of your mouth first and you try to work with me, I'm fighting against those damn fillings. They are poisoning you every day. Get them out first. I tell people, start slow with the lactoferrin. Don't take too much, because it might dump too much bile and you might not feel good. I'm telling people to take 1/64th of a teaspoon, and some people are even taking less than that. Is that great for having people buy a bunch of pills of my supplement? No, it's not great, but it's ethical, and that's what I do. Do I want people to spend money working with me when they're mercury? And I want people to get good results with me. I want people to get good results. So if you can't afford both, get the mercury out of your mouth. Put your time and your energy there. Because if my work won't be very good, and here's the weird thing, folks, if you try to detox while you're still putting toxins in your mouth, you're possibly going to feel worse. Think about it. You have mercury gases being absorbed into your system every day. Those are going into your blood. Anything you breathe from your lungs, it goes right into your blood. Okay? So you're putting toxins into your blood. And then let's say you start taking a chelator or even zinc or selenium. And they come in, they start kicking mercury out of your tissues into your blood. So now you have mercury going into your bloodstream from your fillings, and now you're taking minerals that are kicking mercury out of your tissues into your bloodstream. You now have more mercury in your bloodstream to make you feel worse. And obviously you couldn't get rid of it already because you're putting it in every day and you're probably overloaded. The more toxic you become, the slower your detox becomes. So this is the first step of why I can actually get mercury out of people, is because I get the mercury out of their face first. Then don't eat fish and shellfish. Just don't. Just don't eat poisonous, toxic fish and shellfish. And what we see on hair tests is we see the amount of fish and shellfish that people eat will directly relate to what their mercury level is on a hair test. Once in a while, people will stop eating it, and then we'll see, like, let's say their mercury on a hair test double for one test. What are they doing? They're dumping old mercury, and then the next hair test, it will crash down. That's normal. Next thing we do, we make sure that people who are working with me get proper amounts of zinc and selenium. That is your body's natural detoxer of selenium, or of mercury out of your system. I don't have a problem with getting mercury down on hair tests, except for people who insist on eating fish and shellfish. I can make very good guesses on how much fish and shellfish people have eaten in the last 6 months based on their hair test. And you know what? I don't ask them, do you eat wild fish, or do you eat line caught fish, or I don't do any of that. I just make a guess, and I'm usually pretty close, because all the fish and shellfish has mercury in it, folks. You know how all the oceans are connected? That means they're all getting toxic. Some of them may be a little less, but they're all getting toxic. And don't even talk about like lakes. Those are small, and they don't really have a lot of escape routes for poisons. Lakes are super toxic. So I don't have I will tell you, I used to get rid of aluminum really well in people. All you have to do is avoid the sources. But that doesn't work quite as well anymore. I think there's more aluminum, like, I don't know, maybe coming down out of the air. Don't know how that would get there. Gosh, didn't Let's Go Brandon just talk about potentially darkening our skies to stop climate change? They were already doing it, folks. If you're here and you don't understand what the trails are up there and why the sky gets all foggy and hazy after that happens, if you're here and you don't understand that yet, maybe you're not ready to be here yet. If you can't go out and observe what's going on, you might not be ready for all the painful observations we're making here. Oh, Kurtu commented here, my acne has gotten much better, and she's one of my clients. Yes, Kurtu was is an Accutane survivor, and we are getting people better. So I want you to see, there's like 2 ways that you can go. I went over this. I did a post on Twitter about berberine the other day. Let me go find it. I've been over berberine on a live stream before. Berberine just happens to be yellow and super bitter, found in golden seal, found in Oregon grapefruit, found in barberry. super bitter, very yellow. It's funny, the toxicity symptoms of berberine actually look a lot like vitamin A toxicity. There's photosensitivity of the eyes, there's skin, sun sensitivity, also or vomiting. Like, yeah, it's very similar to vitamin A toxicity and bile toxicity. You have two ways of going about relieving your symptoms, folks. One is to take something toxic that stops your detox. Berberine, cod liver oil for acne, Accutane for acne. You can damage your detox systems and make yourself sicker while you get relief of a symptom. And many of us did this to ourselves in the past. I'm not immune to this. Or we have to do the real work to get the toxicity out. And when the real work is done and the toxicity's out, the symptoms get better, but they're getting better for good. As I've talked about before, like with the testosterone boosting herbs for you guys, since this is a prostate cancer episode, when you take a testosterone boosting herb, what is it doing to raise your testosterone? What is it actually doing? Where did that testosterone come from? And why wasn't your body already making it? Well, let's go over a little theoretical example. In hyperthyroidism, which is always autoimmune unless somebody took too much thyroid medication. Hyperthyroidism, too much thyroid in your blood. It's always autoimmune unless it's a medication thing. Okay. The theory is that your body or the toxicity is destroying thyroid cells. What do the thyroid cells hold? Thyroid hormone. So you're spilling out more thyroid hormone by cells being destroyed. And that's why there's too much in you, because you've lost the ability to regulate your thyroid hormone. Now let's just go and do a little thought experiment of, if you're taking an herb that is increasing your testosterone production, increasing the testosterone in your blood, let's say. Now think of that hyperthyroid example. Is it possible that this herb is actually destroying your testicular cells? And that's what's allowing the testosterone to leak out. And then they always recommend that you cycle these herbs, that you take periods off of them. Why might you need to do that? Do you need to repair the damage? And then usually with these things, they work great the first time, and they only work about half as good the second time, and they work about a quarter as good the third time, and by the fourth time, they don't work at all. You think maybe because enough tissue's been damaged? You can't spur a tired horse for too long, or else the horse dies, right? Some of these things that these herbal supplements or other things that you take, they are robbing from the future to pay. They're robbing Peter to pay Paul. They are kind of taking away from your future testosterone production or whatever to get it today. I saw a guy on Twitter this morning. He's like, I took 25,000 units of vitamin A a day and my thyroid numbers got better. And I'm like, okay, it's not going to end the way you're hoping. This is the honeymoon phase. This is the like you're deep in the toxicity phase. Many people here, and if you want to comment on this, if you took vitamin A or cod liver oil or whatever it was at the start and you felt better, only to realize later that it poisoned you, please comment. Please. Happened to tons of people. I did it with astaxanthin. I took astaxanthin for a while, which is a carotenoid. It's what makes flamingos pink. It's what makes shrimp pink. It's what gives salmon most of its color. I took it at the start and I felt happier and I felt other benefits. And over about 8 weeks, it all fell apart and I was more depressed. This is the duration paradox. Things look good in the beginning, but they're toxic. And so over the long term, they destroy the very thing that they helped. And that's why I felt happier in the beginning and more depressed as I went along. This is the effect. So I feel really bad about this guy who's like telling people to eat their liver and get 25,000 units of vitamin A a day. And if you're eating liver, you're also getting copper toxic. It's not going to end well. Short-term benefits, they don't tend to end up long-term unless you're doing the right things. So Let's see. Oh, John was asking, how does toxic bile leak into the blood? Wouldn't the body have mechanisms to keep this from happening? It's called cholestasis. Liver injury, cholestasis, serum bile, like I've been over before. Serum bile is, there's twice as much bile in the blood in diabetes. Septic shock is toxic bile in the blood. No, the body does not have mechanism. I mean, the body would love to keep this from happening, but if the bile becomes too toxic, okay, well, quick review. What is one of the major components that goes out in bile? Retinoic acid. What is retinoic acid sold as? All trans retinoic acid. It's sold as a chemical peel. Chemical peels, what do? They dissolve skin. That's what they do. So if you had a lot of vitamin A toxicity and you're putting vitamin A as retinoic acid into your bile, you are putting a chemical peel into your bile. That means you're chemically peeling the liver cells that make the bile ducts that carry it, the intestine that it coats on its way out. That's just one ingredient. Retinoic acid, vitamin A. It is a chemical peel. I have the paper where a dermatologist said, we use retinoic acid to induce controlled wounds in the skin. Well, what if you're getting uncontrolled wounds in your gut? Then everybody's favorite boogeyman who doesn't understand bile, they talk about leaky gut as causing all the diseases. And I'm saying, it's not leaky gut that's causing all the disease. It's the bile that's leaking through the leaky gut that's causing all the disease. So, but episode 71 is the one that people like the most in terms of me explaining toxic bile theory. Let's see. I'm running through it. Victoria's asking if the magnesium lotion will have lactoferrin in it. It will. It will. Yes. Let's see. There's a lot of conversation going on in the chat today. Oh, Pavneet asks, when is the video on body odor and deodorant coming? It's we're editing it now. We had my video editing person had some personal issues that came up, so there was a delay. Life happens. But yeah, we're working on it. So funny thing, the hydrogen sulfide plays a huge role in body odor and bad breath. I think I've been over the study before where they actually, one of the ways they measure bad breath is by hydrogen sulfide in the breath. And there was a study where they gave people lactoferrin. I think it's 2 studies. And their bad breath was like immediately better. Or like within 10 minutes or 20 minutes, they did another breath sample. So, and what does lactoferrin help in the research? What massive detox enzyme that I talk about all the time? Lactoferrin's been shown to speed up ALDH. It's all connected. Let's see. Oh, the greatest story ever lived. She heard this. She says, thank you. She just heard this with me. Cool. Excellent. I hope it helps. And if you want to do any testing, like with the zinc and stuff like that, just, you know where to find me. For those of you who don't know, if you want to work with me, see the consultations tab on nutritiondetective.com. And you can email Julie if you got questions about that too. Okay, so here's just another person commenting on zinc. Anne-Marie Polden says, zinc builds up by 3rd day. I'm in full flu zone. Yikes. Then feel $1,000,000 3 to 4 days later. Okay. So this is a good observation. Let me help here with a concept I call it pulse dosing. So if you feel like this is for any supplement that you feel like there's a benefit at the start. Oh, I see that there are some super chats. So I will get to those, I promise. If you feel like there's a benefit at the start, but as you take it more days in a row, you start noticing some negatives, like whatever you took was pushing, let's say, detox too hard. Like you were getting the benefits of having it in, but you were building up something in a negative way over time. Pulse dosing is a way of working around that. What it would be like, I can't tell you how many days on and how many days off. But like if you were saying by the third day, Anne Marie, you were having negative symptoms, how might we try to experiment around this? And you're saying it takes 3 to 4 days to before you feel like $1 million. You might do an equal amount on, because you're saying it takes 3 days to build up and it takes 3 days to wear off. This is a figure it out on your own thing. I can't tell you what the exact numbers are, but it might be you try it for 1 day. You take it 1 day, and hopefully the negatives don't build up. And then you skip 1 day. And then you take it 1 day. And then you skip a day. And you take it a day. And hopefully you can get the benefits of improving your zinc without building it up in your system to where you get that massive bile dumping, because that's what the flu is a big prolonged massive bile dump that's leaking into your blood. So that's where if you could figure out, like if it was 1 day on and 2 days off that you need to do, then that's what you do. So you just want to see like how many days can you take something without the negatives building up too much. And then you take, if you do notice, or to avoid the negatives building up, you take a certain amount of days off to kind of like flush the extra out that might have caused your symptoms. So this is what I call pulse dosing. It's really helpful when you have especially a benefit at the start, that then if you take it like too many days in a row, you build up a negative. Now you could also just do a lower dose. That might avoid the things, the problems showing up. So pulse dosing or just taking a lower dose. So let me go look at these super chats. I see you, super chatters. I appreciate you. Okay. Wait, is there oh, that's what Pierre meant. Pierre sent me a chat history. Let me get in here if my computer can handle it. Hold on. Oh, wow, he's there. Oh, wow, Pierre. Pierre is the man. Okay. So, yes, and Will sent me a super chat. He said, don't miss this super chat yet. I didn't. And he said, Pierre seems to have given you a private message on the chat history. I didn't know if Pierre was talking about old chat history or not. So we got that one. Cool. And I will come. Thank you, Will. If you have a question, Will, you could post it. And I'll get to that stuff in a second. So Zendog Breath posted, morning still shopping thiamine sources. Bulk supplements is global as in China. Solgar current source has other ingredients. Others are expensive. A lot of stuff comes from China. You're probably not going to be able to avoid, if you wanted supplements and you wanted to completely avoid China, you're probably not going to get around it, which is going to be really funny for all the people who are like on their bioidentical hormones or other things like that. When, if you've been paying attention, the scripted drama between us and China and us and Russia is starting to reach a fever pitch. And just think, and even maybe, who knows if India would be involved, but what if China stopped sending the US their hormones? Synthetic or bioidentical. This is why it's good to try to fix your hormones in a more natural way, folks, because somebody might say, well, what if they stop sending us zinc? Well, if you've been working on your zinc, at least your zinc would be better than if you had never worked on it. But once you run out of hormones, that's gone, right? So if let's say like the gentleman in the video that I did, the testosterone boosting, where we got his testosterone from 330s to 930s. Do you think that's going to fade away like really quick? No, because we fixed his toxicity and we helped fix his deficiencies. So now it might degrade if he was not getting enough zinc, let's say. It might degrade slowly over time, but it's not like a guy who's injecting steroids and all of a sudden he's not injecting steroids. You see the difference? Or somebody taking bioidentical progesterone and all of a sudden they're cut off. Like when you take hormones, you're not fixing anything. You're helping your symptoms to feel better, but you're not fixing a damn thing. You're actually covering up what needs to be fixed. The example I give of this would be like, let's say you can have a guy who has low testosterone symptoms. He's got low libido. He's got erection problems, all this stuff. And he takes testosterone replacement therapy. Now, let's say zinc and selenium and magnesium deficiencies were a big part of his low testosterone, and vitamin A toxicity, and copper toxicity, and all these things. And he takes testosterone replacement therapy to cover it up. Or he takes testosterone boosting herbs to explode his testicular cells and free up testosterone into his bloodstream. Over time, like, as just a quick example, does zinc have something to do with your immune system too? Yeah. So if you don't fix the zinc deficiency that was a big part of the testosterone problem, does taking testosterone fix your immune system? No. So then all the problems that you had that you got on the testosterone therapy about, or that you have menopausal symptoms about, or whatever, they're all going to slowly get worse. And you may not care about them because, let's say a guy who's on testosterone, he's like, my muscles are good in the gym and I get good boners, and and they're happy. They're just like, cool. All my guy problems are better. While underneath it all, the other problems get worse. And then over time, eventually those problems get bad enough that they're either getting new health issues, or they have to take more and more testosterone to try to get some of the benefit that they used to. Because it's a drug effect. Drugs lose their effect over time. That's the nature of them. So then you get to a point where the doctor won't give you any more testosterone because he's like, I can't push your levels any higher because then I'll get in trouble, because now it's going to look like you're taking steroids. And the guy's like, but doc, I don't feel the effect anymore. And I'm sitting here explaining why. And they may still not want to work on it. That's cool. There's a price to pay for everything. So anyway, thiamine. The one I like, thiamine, here, let me find it. I'll just post it here. I do not like allithiamine, the fancy B1. I don't like allithiamine. I don't like the guy who sells it either. So, B1, that's thiamine HCl. I'm not a big fan of mononitrate either. I don't like taking nitrates. I don't think taking B1 with nitrates is necessarily a great idea. Yes, I did do a video where I helped my son with it. And that's the urination at night. I don't know if that video is still up on this channel. But anyway, B1 can hugely help your kids if they have nighttime wetting the bed. I like thiamine HCl. Dr. Clark's makes, did I post the link? I think I did, right? Yeah, I posted the link to Amazon. So yes, we're getting bigger, folks. We're getting more of the haters who like to use character attacks instead of there was somebody in the chat apparently that some of my moderators booted. Yeah, I have zero tolerance for people who want to come on and throw character attacks and insults without actually going after the evidence that I present. Zero tolerance. So be careful of how you come at me, bro. That's what I'm going to say. Because here's the thing. People may over time realize that we have the answer for them here, but they were an a-hole when they first came on. Sorry. Life sucks. Life is hard. Okay. So thiamine HCl, it's probably Chinese. You're probably not going to find anything that's not Chinese in the thiamine world. I would bet even that allithiamine is probably Chinese made. Why do I not like allithiamine? It has a disulfide bridge. I don't like garlic. Garlic is full of sulfur. I don't like disulfide bridges. Thiamine HCl has one sulfur in it. It does have a sulfur in it. Many things have sulfur in it. We're just trying not to put in too much. Anyway, Solgar, I went and I looked at some Solgar supplements the other day. Solgar has so many additives in it. Solgar is like probably one of the worst brands I've seen in terms of additives and fillers and excipients and garbage like that. I don't like, just on its face. I don't know about the ingredients that Solgar has in their stuff. The alternative, the extra ingredients are just, it's a nightmare. I wouldn't buy their products personally. Okay, Trusty Rusty, next super chat says, my mom seems to be suffering from SIBO since she got the pokey. We've been trying the program, but so far she's not having any relief. Okay. Trusty Rusty, I want to tell you, I notice your comments where you always say love this doctor, and I do really appreciate that. I do notice those, so thank you. Folks, I'm going to give you some real talk here right now. This is my perspective on it, and I'm going to tell you my actions, not just my words on this. If there is, an experimental genetic therapy that people took, and do I think there's a big difference between the brands of the pokey? No, I don't think there's a big difference between the brands of the pokey, mRNA or not. I don't think they'd allow you an escape route, if you know what I mean. My mother was talking to me about visiting her family up in Washington State. Now, my mother did not get the pokey. No one in my immediate family got the pokey. My ex-wife probably did. And all of my mother's family, so all of my family on my mother's side got it. They live, in northeastern Washington. So that's like central, I couldn't imagine living there and not getting it. That would have been really, really hard. So I told my mom, so this is my perspective on it. I told my mom, I said, and we've already seen 2 of her family members start to have significant cardiovascular issues, if you know what I mean. I told my mom, I said, I think you should go visit them as soon as possible because this may be your last chance to visit them in person. Because my mom's got her own issues she's got like some Parkinson's-like syndrome that I think is aluminum caused, which we've seen on hair tests now as it's coming out like crazy, but it's high. So I think aluminum is the main cause of my mother's neurodegenerative issues. And when neurodegeneration, brain stuff goes far enough, I don't know if it can be saved. And this is what most people say. Anybody who thinks they have a cure for things, they'll be like, if you don't get it early enough, you might not be able to fix it at all. But my mom did not take it and has not had any other health problems other than this neurological thing, which I've been over. I think I've been over it before. She lived on it. She had mercury fillings for 40 years. She had breast implants for 30 years. She lived on a golf course, for like 6 years. And when they would spray on the golf course, her symptoms would get significantly worse. Like my mom, and she worked in the dental office for 40 years. These are not good things. And all that toxicity doesn't necessarily just come out. SIBO. I've been over this before. SIBO is when your bile is not making it from your liver to your guts. It means the bile is going backwards into your blood. They know how to induce SIBO in dogs by tying off their bile duct, their main bile duct. And then the dogs get SIBO because one of the benefits of bile is that it can keep certain bad bacteria in your gut down. And so if you don't have bile going into your small intestine, things grow that aren't supposed to grow. So I want you to understand that I'm going to tell you right here, right now, in my opinion, you need to get okay with the potential for the people in your life who got the pokey being gone relatively soon. That's the way I'm perceiving it. I'm like, you got to realize that they made a mistake. They made, in my assertion, a huge error in judgment. Whatever reason they did it, it doesn't matter. There is a price coming that will be paid. I have no doubt of this. We're already seeing it. But I do think, I believe that the next big scare, just imagine if let's say I believe that viruses are a marker of, and let's say that 50, 60, 70, 80% of the population had the same toxin put into them. The same one. And then all of a sudden, let's say there was some trigger that they could do. I don't know, maybe electromagnetic. There was some trigger that they could pull that would then activate the problem in people. And let's say it looked even worse than the problem did the first time. And more people were not existing after this. And it was very, very scary. But the people who didn't get the therapy, this is the thing I want you to watch for, folks. If and when this happens, ask everybody you know who's having a problem, did you get the thing? Did they get the thing? How many of the things did they get? I'm sure you're going to see a pattern, a huge pattern of the people who didn't get the thing are just fine, or they get a minor cold. It's coming. They've told us it's coming. I do not know. So if we're talking about a genetic therapy and people are like, oh, just take this supplement or just take this anti-parasite drug, right? They've convinced people to take anti-parasitic drugs for these problems. Anti-parasitic drugs. I'm sitting here telling you that these are super toxic to the liver. You can be on one side with one philosophical, political idea, and you get the pokey. And on the other side, they've convinced them to take anti-parasitic drugs, which are also toxic for the liver. They get you both ways. You could be in the pharmaceutical side, or you could be taking tons of B vitamins, which are made from coal tar ash on the other side. Either side of the mainstream, conventional or alternative, is giving people the wrong solution. But I don't know how else to put it. We can do what we can. I mean, being on the program is one thing. Remember, we have a limited time before what I think is the time bomb, the ticking time bomb is coming. What takes longer? What are the factors that make it harder to fix somebody or that will take longer to fix somebody? How old they are. How intensely sick they are. How many conditions they have, because that's showing more weak links are breaking. Okay. And then sadly, women take longer than men, probably because they store fat more and probably because women have kind of volunteered to put more toxins on their system. Women tend to go to doctors more, so they get more pharmaceuticals. Like there's lots of reasons why women are worse off in terms of detox than men. That's just that's what I see. And men also make more bile than women, which means that men could theoretically detox faster than women. And this is in the research. So, undoing vaccine injury is probably going to take a long time. I would look into, if she's having SIBO stuff, I would look into the probiotic articles in the Love Your Liver program. I would start with those. Look at the order of adding stuff. This is an article in the Love Your Liver program. Do the search and make sure you search everything. But find the order of adding stuff. This is a very important article. It talks about the things that will give you the most payout the quickest in the program. The things that are the easiest to fix and the things that you should do first. Don't do the things at the end of the order of adding stuff. That doesn't mean they're more powerful. It means that they're actually, as we go along, some of the things are more likely to dump bile and make people potentially feel a little worse for a while. So we do the things that have the biggest impact first. Okay? Yeah. But I really get yourself right with potentially the people who made that mistake not being around past possibly the end of the year. That's how I feel about it. And this may seem really sad for a while, but right, you're going to go through the 5 stages of grief and all that stuff. It's a real decision that people made. So JS is asking, is it okay to still take ivermectin? If you're taking it, like I'm not going to answer that question. because is it okay? Like, so I'll put it this way. If I got hit by a bus, do I want to go to the hospital because that's the like leaving me bleeding out in the car, trying to take herbs, trying to take minerals, doing a vitamin C IV, that's not going to keep me alive. I want to go to the hospital because that's where, if conventional medicine was good for anything, it's for acute, like, I'm bleeding out. I just took my kids to a class called the Stop the Bleed class. Oh, for those of you who want to know, stopthebleed.org. They teach people how to stop massive bleeding. I took my kids to it. 12-year-old, 14-year-old. I took my kids to it this weekend. You learn how to use tourniquets. You learn wound packing. I want my kids to know how to do this so that they could, potentially. I told them, I said, hey, you might save dad's life someday with this. They're free classes. Typically, they're free. I did go to one where they charged $25, I think, so that you walked out of there with a tourniquet, an actual tourniquet to potentially use someday or practice, or at least practice on. So anyway, I'm trying to think of why I said that. Yeah, but so that's, so when you want interventions right now, we're not using, so you have to think of, most of my work is long-term. Like, I'm fixing the long-term damage with long-term solutions. Acute stuff, I would put it this way. If I was so toxic and my bile was so toxic, as Will pointed out here in the comments, he said ivermectin's mechanism is shutting down bile. Yes, it slows down ALDH, it shuts down bile production. Those two go together. As he said, no bile allows the body to heal and remove parasites. This is good short-term but causes liver injury long-term. What I'm saying, if you want to see here, let me put the link to Mawson's study up. I'm going to want to at least read this, the abstract from Anthony Mawson. With this, whatever it was, this syndrome, viral syndrome that people had. And I mean, people had it, this viral syndrome. I'm not going to deny that. A lot of people who kind of didn't believe in it, you guys who have been here long enough know that I don't believe these terms that I'm going to say, but even people like myself caught it, whatever it was, and it sucked. It sucked. It was the strongest flu I've ever had. Have I had anything since? No. But whatever that was, there was a lot of people who thought they were really healthy and they were never going to get it, and they got it and it kicked their ass. So, if I were really bad, like if I were thinking it's hospital time, if I got that sick from whatever this was, and I knew it was from bile dumping, might I take a pharmaceutical that short term would keep me alive, that maybe long term has a little bit of a problem? Yeah, I'd take it. Yes, I would. You have to understand there's context to these things. Living is better than dying. So if you have to do something, but I mean, there's people out there taking these medications like multivitamins. They just think, oh, I mean, first of all, they'll be like, well, it won the Nobel Prize. And I'm like, you know who runs the Nobel Prize things, right? It's the same people who don't want us around anymore. So, gosh, you could never imagine them fooling everybody by saying that this thing is so wonderful, because they know later on it's part of the plan to have half the people taking this with the other half getting that. Okay. Here, let me. I can't even find it now. That's crazy. You type in the name of a website into, there it is. Where is it? Let me find it. I don't want to say it. Maybe I'll post the link. Oh, I don't have my phone in here. Anyway, how am I going to find this article here? No, I'll put it up maybe next week when I have the exact website. Somebody was asking, what is the evidence that we know it's a ticking time bomb? There isn't. You think they give that to us? They wouldn't have. Nobody's going to publish that. I can tell you, like, I tried to do a search for this guy's website where he goes over all the things that were found in the pokies that were not disclosed. I do a search for the website name, and the website name doesn't come up anywhere. It's almost like it was suppressed. They wouldn't tell you. But I remember at the very start of this whole drama, somebody very early came out and said that the time zone on this, the ticking time bomb, was about 3 years. And I paid attention to that. I was like, how would they know that? But don't they always tell us what they're going to do first somehow? They always get it out to us. I think it was Mercola who came out with that. I think somebody can back me up or not on this. I swear somebody told me afterwards. They said, "Oh yeah, that was Mercola who said that." And I was like, "How would he know that?" Huh. So what I'm going to say, I mean, we saw the early stuff on people getting sick from them. If there was some ticking time bomb, or if they had some trigger, a megahertz trigger, an EMF trigger that could then make it seem like everybody was getting sick at the same time. Okay, well, I'll get to it. And then they can say, ooh, it's a new pandemic. It's a new one. And everybody has the same thing showing up in our tests that they might have put into people. Okay, so let me find this other super chat. And I think we're going to wrap it up. I was asked to start the inner circle on time today because I tend to be late. I need to stop making these go over 2 hours. So, okay. Alexi, I see it now. Alexia, how did I miss that? Advice on upping folate without supplements and overdoing beans. Also hard to find white asparagus around here. Well, I'll be honest, I don't care that much about white or green asparagus. If you can't find white asparagus, eat the green stuff. I think asparagus is great. Now, without doing supplements and without doing beans, that's going to be a rough spot. Let me go look, because I don't have necessarily the lists of these foods wrapped up in my head. Beans are number 1 in folate. Asparagus is number 2 in folate. I think, okay, I'm going to tell you guys, I think asparagus is like a magical food, like in a good way. There is something about asparagus. I don't care what people are going to say. Well, it has some vitamin A in it. I don't care. There are certain things that if you avoid everything bad that's in every food, you're not going to eat. You're going to run out of foods to eat. You're going to die. The surest way to death is to starve yourself. And now even the longtime fasting gurus are starting to realize that, ooh, all this fasting I was doing all the time, maybe it wasn't such a good idea. No joke. Okay. So I think asparagus is worth it. I feel amazing after I eat asparagus. And yes, I do have the asparagus pea, which now that I think about it, now that I've been taking some B1 personally, I actually really feel like there is a definite similarity. You know, they're not exactly the same, but there's a definite similarity between asparagus pea and B1P. So what do we have next? Eggs. Oh, don't make the egg mistake. Don't listen to the people pushing eggs. The people pushing eggs in the vitamin A toxicity world are now they seem to think that vitamin A is not a toxin, and they seem to think that pork and egg yolks are the best things to eat. Talk about missing the boat. Really sad. Leafy greens, don't do those. Beets, don't do those. Citrus fruits, don't do those. Brussels sprouts, don't. High sulfur, broccoli, high sulfur, don't. Nuts and seeds. Okay, nuts and seeds. I went over nuts and seeds last week, I believe. Nuts and seeds are quite high in copper. They are quite high in copper. I would not make them a very regular thing. Like having them a couple times a week, maybe. Okay, and if you're one to pig out on the whole bag, you better watch out for that. Oh, beef liver, great. No, don't do that. Wheat germ, it'll poison you with manganese. Don't do wheat germ. Papaya, that's all vitamin A. Bananas. We love bananas around here. So what do we got? Bananas. We got some, nuts and seeds on occasion. If you were going to do a cruciferous vegetable, do cauliflower because it's white. Asparagus. So we got beans, we got asparagus, we got bananas. What else do we got here? Avocado. Okay, the thing about avocados. So that we have research. Avocado has a decent amount of vitamin A in it. Avocado also has a lot of fat in it, obviously, which helps you absorb vitamin A. We have studies showing that vitamin A increased or avocado with a meal, avocado oil or avocado with a meal increases the amount of vitamin A absorbed from a meal. And don't forget that eggs increase the amount of vitamin A absorbed from a meal by something like 5 to 8 times. So if you're going to have avocados, here's the thing to realize, folks. If you're going to eat something with vitamin A in it, be really, really, really careful about how much fat you eat with that, because the fat is going to increase your absorption of vitamin A. Fortified grains. Well, we don't eat fortified grains. My goodness. So yeah, you don't have a lot of options. So if you were worried about white asparagus, I would really try to. This is where people can get so obsessed about the amount of vitamin A in something when there can be other benefits like prunes. If you're not pooping, dried plums, as in prunes, could be a really, really good option to help you to poop, because we want you pooping. That's how you're supposed to get rid of the bile. If you're not pooping, your bile is going to your kidneys or your skin. Okay? You're reabsorbing the bile that was in your guts, and it's going to your kidneys or your skin. Not what we want. So I would rather you took a little vitamin A in the form of, let's say, prunes to poop than not. That's just, we have other pooping helpers in the Love Your Liver program. I'm just giving you another example. So, I'm just looking at another list here. We got asparagus on here again, bananas on here again. Yeah. So you're looking at, some nuts and seeds, asparagus, bananas, or beans for your really high folate foods. Big thing would be reduce your intake of vitamin A so that you don't deplete your folate and B12 and all those things from vitamin A. I have a video on this channel showing the research about how vitamin A depletes folate and B12. I see Pierre's post in there. Now, the supplements, just so you guys know, to show you probably how important folate is, folinic acid or calcium folinate, those are the only two that I like. They're the same thing, basically. Calcium folinate, folinic acid. So it's folinic acid bound to calcium. They come together, they make it, it's called calcium folinate. Do I love the calcium in it? No, but that's the only form you're going to get. And it's in micrograms, so I'm not too worried about it. Normally, calcium's dosed in milligrams. So if this is in micrograms, it's not much. So let's do it. Let's put on our thinking hats. Is folate dangerous? Do we actually think that folate is dangerous to people. I hope you don't think that. Folic acid is garbage. Throw folic acid in the trash. When you see studies that say too much folate is bad, always look in the abstract, or at least look in the abstract and see that they used folic acid. Folic acid is trash. Why do you think they fortify foods with folic acid? Because they don't like you. So now the FDA has deemed it necessary to make it so folinic acid, calcium folinate, is prescription only for chemotherapy patients. They just took the most bioavailable and useful form. Notice that they didn't make 5-MTHF, 5-methyl tetrahydrofolate. They didn't make that prescription only. I don't like that stuff. I like calcium folinate and folinic acid. And they just made that prescription only. I mean, why would they have to make it prescription only unless it was dangerous? We know it's not dangerous. I can't find anything on it being dangerous. Why are they taking that form away from people? And that just happened to be my favorite form. Is it because of me? Probably not. It's bigger than me. So, they also make high-dose potassium pills, prescription only. Gosh, they must be useful too, except those high-dose prescription potassium pills are so full of garbage, right? So even if they make something good for you, they're going to make it time release, and they're going to, I mean, just go look up what K-DUR, K-DUR, K-DUR. Go look up those pills. Look at how much extra garbage they put in there. But they'll let you get a 1,500 milligram potassium pill in one shot. Can't be that dangerous if they'll give you 1,500 milligrams in one tablet, right? I'm not saying to go out and take 1,500 milligrams all at once. I'm not giving you any advice on potassium dosing. That's all in the program. Potassium is something that if you don't pay attention, you could mess it up, especially with supplements. Supplements are how you can mess things up the quickest. Like with anything, they're the most concentrated. I take these things very seriously, folks. People wonder why, I don't just give all the information out here, because most people will take a little bit of information, as they say, take a little bit of rope and hang themselves with it. Because you didn't read all the information, or you missed the really important part that I said, don't do this. And you're just like, oh, I guess I missed that part. Can people still do that in the program? Sure. But at least I know they were interested enough to make an investment to get in there. So, let's see. Okay. Yeah, there was some fun stuff going on in the chat today. Have I cut off super chats yet? No. Super chats are still going. Let me just make sure I didn't miss any. Let's see. Oh, wait, let me look at Ramon's. Oh yeah, I have the things from Pierre. Let me go over those real quick before I end this. Okay. So Ramon, I see that Ramon changed his work schedule so he could watch the live streams. Ramon is dedicated. That is dedication, Ramon. So Sam is always here right at the beginning to post stuff. That's why I didn't want to miss his stuff. He said, "How are you?" Here's Sam's quote. This was from the chat before I started. "How are you doing today, Doc? I wanted to ask you about your philosophy when it comes to eating copper-containing foods. Even in the Love Your Liver program, there are many foods that contain quite a bit of copper, such as lentils, grains, mushrooms, nuts, and seeds. Do you avoid them or just certain foods, or how do you go about it?" Now, here's the part I really wanted to read you. "Thank you for your work. I'm recovering from 14 months of Accutane usage, and after a year off, I'm starting to see improvements thanks to you. No other doctor has had even an idea of how to overcome this. Keep fighting the good fight." So, Thank you, Sam. I'm glad we are helping. Sam is very inquisitive and has lots of questions. And so asking about copper. We are I'm going to be honest about copper here. Copper is okay. When I find somebody with vitamin A toxicity, which is pretty much everybody who comes to me, they have copper toxicity as well. And we have seen that vitamin A, the chicken study, the infamous chicken study, shows that vitamin A lowers ceruloplasmin, which is the protein your body makes to protect you from copper. It's not to escort it around and put it in the right place. No, it's a binding protein to protect you from copper. Because free copper is super toxic, just like free vitamin A is super toxic. That's why your body makes retinol binding protein to protect you from it. A lot of these proteins, when you see proteins that are bound to something, most of the time is to protect you from it being free in the blood. Okay? We have binding proteins for all sorts of things. Do you know how many binding proteins we have for iron? Like, do we need iron? Yes. Free iron is so toxic that I swear we must, I never counted them up, but we must have at least 20 or 30 binding proteins for iron. Okay? So, copper. Copper toxicity we are starting to realize as we have gone through this long enough, copper toxicity seems to take even longer to get rid of than vitamin A toxicity, which might potentially start to explain why the people who come to me who got sick eating tons and tons of liver are the second hardest to fix after Accutane people. Because the liver people poison themselves not only with vitamin A, but with copper as well. Now, if you start having to avoid, okay, so as Sam, let's look at that little list. There are many foods that contain quite a bit of copper, such as lentils, grains, mushrooms. Let's just say beans. Let's just say beans, grains, mushrooms, nuts, and seeds. Remember how I said earlier, if we took out everything that contains something bad, you'd have nothing left to eat. This is a really good example. We are trying to figure out the highest copper foods and minimize those. Now, we also know soluble fiber binds up bile. So the question becomes, if you're eating, let's say, soluble fiber foods, oats or beans, does the binding capacity of the soluble fiber surpass or absorb enough bile that has copper in it is it a net gain or is it a net loss? Do you see what I mean? Are we getting rid of more copper via the soluble fiber versus how much copper may be coming in? How bound up is the copper within the soluble fiber? Do those foods have a lot of soluble fiber to bind up copper? Because it's toxic to them too. So what we are doing, what I tell people who have known copper toxicity or who are very sensitive to copper, they're going to need to really watch the copper in their foods. Let me explain once again why the all muscle meat carnivore diet seems to help so many people. Now, I don't think it's good long term by itself, but an all muscle meat carnivore diet is high in zinc. We like zinc. It's super low in copper. Still has some. You can't avoid all of it. And it's super low in vitamin A. High in zinc, low in copper, low in vitamin A. Gosh, I wonder why people feel so much better on it. Is it because of the lack of plant foods? Kind of. It's more of what it has and what it doesn't have in it. Okay? The problem with the all muscle meat carnivore diet is if you don't eat any fiber at all, soluble fiber especially, you are going to crush your bifido population. This is shown in the research. You will have almost no bifido in your gut. We just so happen to, when we're born, we have the highest bifido populations of our entire life when we are born. And it is not natural for them to see bifido populations go down as we age. Do we tend to be more vibrant as we age, or do we tend to lose vibrancy as we age? We tend to lose it. Why do we think kids are so healthy and they can get away with all sorts of things? Well, they sure do have a lot of bifido. Coincidence? So if you're going to do an all muscle meat carnivore diet, you sure better figure out how to get some soluble fiber in there so you don't crush your bifido entirely and guarantee a dysbiosis that later will cause you to have all sorts of bile problems. And then you're not going to poop out bile on an all muscle meat carnivore diet because you're not pooping very much and there's nothing binding the bile. So you're just going to reabsorb it all. It just goes right back to your liver. So that's the benefit there. So if people notice, or if you were, here's some things you can do to help with copper. Simple things. The classes of foods that have copper in them. Let's say you go and you're trying to pick some beans to eat. You decided you're going to include beans. Look at the beans list. Which are the ones highest in copper? Which are the ones lowest in copper? Pick the lowest one. You're going and looking at grains. Well, if you're trying to get high soluble fiber grains, there's not a lot of choices. You got like oats and barley's black belt level. You better be real careful. And what I mean by black belt level is barley may kick your ass. So it happens more often than you think. But who else tells you this? Nobody. I tell you these things. This doesn't mean what I'm saying is not working. It means I'm warning you. Like, you start messing with barley, it's a black belt level grain, you might get your own ass kicked. So look at the copper contents in grains. If you tolerate grains, pick the ones with lower copper rather than the ones with higher copper. Same thing with nuts and seeds. You can look at the copper content and pick the ones that are lower in copper versus the ones that are higher. This is how we can do it. But again, nuts and seeds, I don't recommend tons of those. Those are pretty high in copper from what I recall. So that's that. But you're not going to be able to avoid copper if you're eating plant foods. You're not going to be able to avoid, we can't avoid all vitamin A. We can't avoid all copper. We can make it less though. So that's what I would do. And then getting your zinc right. Because remember, you need zinc to detox vitamin A. You need zinc to detox copper. Getting your zinc right will help a lot. So people who aren't testing, who let's say they're following my hedged bet on zinc dosing, so you don't take too much without testing. But if you need twice as much as that to refill your deficiency, do you see how you're kind of stuck? You're not testing. So you're doing the right thing of not overdosing without knowing it. But what if you need a ton to refill all the deficiencies that happened to you over the previous decades of your life? But you never get that amount. Remember, Grant Genereux took 50 milligram zinc pill. I don't know how many times he did it, but he said he'd take one and he'd feel better for like 2 or 3 days. And he was eating like 1.5 pounds, maybe up to 2 pounds of meat. I don't remember what he said in his early phases of his book. I think later on he was down to about 1 pound of meat a day. But I think in the early phases of his book, he was eating 1.5 pounds to 2 pounds of meat a day, of red meat, bison or beef. And he took a zinc pill, a 50 milligram zinc pill once every 2 weeks, and he would feel better for 2 or 3 days. Do you understand what that means? It means he was still zinc deficient on 1.5 pounds to 2 pounds of meat a day. I fix zinc deficiency in everybody. Doesn't mean everybody can take the high doses of zinc off the bat, but zinc deficiency is there in just about everybody. So, let me see. Somebody put it. N Rustica says, "What day of the week do you stream? Please pick one." I'm guessing you haven't been here in a while. N Rustica, I've been doing Mondays for, what is it, like 1.5 months now? 2 months. I moved them from Fridays. So this is the new normal time. Didn't need to do a super chat for that one, but I did get to see your question. So yeah, 10 a.m. So that we're working on the streaming software and we will get that on. I'm going to go practice. I said that last week, but we will get, Just Andy says, I can still get folinic acid in the UK. Yes, so here's the deal. Well, in the UK, yeah, I don't know what the UK rules are, but what they have basically told producers of folinic acid, calcium folinate in the US, they have said you can continue selling You can continue selling what you've already made. Like they grandfathered it in. They grandfathered in folinic acid for what they had already made. When they run out of that, from what I understand, they can't make any more. And then it's going to be compounding pharmacies and stuff like that. Now, I will most likely be figuring out a way to help people to continue to get calcium folate or folinic acid. But it will be through a compounding pharmacy, which will require a prescription. Compounding pharmacies cost more to make stuff. A prescription is going to involve a cost there. But stuff's amazing. It really is. So I would go and buy what you can now if you know you tolerate it. You may want to start slow and buy one bottle, try it out before you jump in and buy 4 bottles or whatever. So anyway, okay. We're all done for today. Hope you all enjoyed that. I will see you next week. Don't eat vitamin A. Minimize your copper. Get your zinc wherever you're getting it from, but don't overdo it. And y'all have a great week. Bye now.